All right, welcome to our live stream. This is Dr. Duke Majan. We're going to be operating on a young lady who I think she just turned 93, and she has had 94 when? Next month. Okay, so in March. So just a month away, so to speak, from 94 years old. So for those of you out there watching and saying, hey, am I too old for spine surgery to get rid of my back pain? The answer is no. She's a very spry and healthy 93 going on 94-year-old, and she's been treated here at Duke Spine for a while. We've been doing some pain management treatments for her, but she's been developing left leg weakness, numbness. We call it radiculopathy, and we realized from getting an MRI that she's got pinched nerves at L2-3 and L3-4. So we are here to unpinch those nerves. Shot. And we're using a minimally invasive treatment called the Duke laser disc repair. Shot. To do this unpinching of nerves. Now you could see the entire surgery is going to be done through a tiny incision that is quarter of an inch, 7 millimeters. We say. Hold on, Jordan. All right, go ahead. Could be a little more medial. All right, lateral, please. And normally we would say this is a bloodless surgery. However, obviously there's a little bit of bleeding involved, not much, but don't move. For some patients, Shot, they take blood thinners, so we have to deal with that. Shot. You're doing great. And blood thinners, of course, most commonly are antiplatelet agents, so they block the formation of the platelet plug. You okay? I can feel a herniation right there.
Keep your hand still, okay?
Shot. Where do you feel that?
Where are you feeling it? Huh? Where are you feeling the pain?
AP?
Hip?
In her hip?
Yeah.
Yeah, that's that painful disc. So that's your L2-3. Shot. Let's go. Come on, Jordan. We need an AP. All right. Back to a lateral. She doing all right?
You doing all right?
What'd she say?
Where are you having the pain? Where does it hurt?
Well, let's just listen and see where it is.
Your nose is her
Her nose?
We can fix that.
All right.
She said she can't turn her neck. So she wanted this, yeah.
All right. Well, her nose is hurting. Not bad. Shot.
Let's bring your hand up a little bit. Is that okay right there, hon? You can hold my hand. You're okay.
You're doing great.
Doing fine.
All right. So we are in the 3-4, and the 2-3 I'm not quite in. Give us another shot. That looks good. So you can see 5, 4, 3, 2. Any back pain?
Left side.
Left side.
Yeah, that's your bad disc. We found it, and we're in. Wonderfully. You're okay. You're doing great. Just take a deep breath. So basically, she's got, as you can see on the x-ray, all of her discs from L2 down are degenerated. Lay still. But 2 of these discs are pinching the nerve really bad on the left side, causing leg weakness, numbness. That's the L2-3. These are herniation degenerated discs and L3-4. So she has spinal stenosis and she has radiculopathy. The nerves, they come down from the spinal cord and they run just past the back of the disc. So if you get a tear in the back of the disc, a herniation forms, it starts to pinch that nerve in a process called spinal stenosis. And it's from the tear and the herniation that you get spinal stenosis. Okay? Are you comfortable? Your nose is not? All right. Are you having any pain? No? How about now? Yeah, how bad is that on a scale of 1 to 10? Show us the tear. That was L3-4. How high did it go on a scale of 1 to 10? So I could see her tense up, her back got tight. She started saying, oh, 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 oh. That was a 10 out of 10. Is that where you get your back pain typically? All right, we're going to fix that for you. When you wake up, it'll be gone. Are you better now? So when I do the discogram, I put a little pressure on the disc by putting the liquid into the disc. It's mostly saline, but also a little contrast dye so we could see it on x-ray. Are you comfortable now? Yes? All right. Okay, how bad is that on a scale of 1 to 10? She's howling in pain. How high did it go? How high did it go? 10. All right. I'm so sorry, sweetheart, but we just confirmed that those 2 discs we're fixing are causing your back pain. Great news. When you wake up, that'll be gone forever. All right. Let's go ahead and put her to sleep. So let's talk for a moment. Why is she here, folks? She's here for 2 reasons. Horrible back pain from the L2-3, L3-4, but also horrible pain down her leg, numbness and weakness. That's just medicine going in. You're okay. You could see from the x-ray that she has tears in her disc. Is that the propofol that bothers her? All right. Her nose is itching her or bothering her. Okay. Any questions from our audience so far?
Yes, we have a question from Facebook. This is one of our Croatian viewers, I believe. I'm going to go on a limb and say that their name is Labisa. And they asked, what do you think about percutaneous laser disc repair, PLDD?
Percutaneous laser disc repair I don't do, and I don't agree with it. It's better than open surgery, but look, in the end, the technique is what matters. And if the surgeon has good technique and does a good job, then you can have a good result. We're doing not percutaneous. Percutaneous is basically procedures done through a needle. And as you're going to find out in a moment, we're not doing this procedure through a needle. So far, we did the discogram through a needle. Lay still, you're doing great. But we're now going to take the needle out and we're going to do the actual surgery. We've already made an incision that's 1/4 inch. So this is not percutaneous. This is true endoscopic surgery. The problem with percutaneous discectomy is it only removes the disc, but it doesn't clean the tear that the disc herniation came out of. And that's the key, is the Duke laser disc repair is the only surgery in the world that's ever been published to do what's called an annular debridement, where I'm cleaning the tear in the back of the disc where the herniation started. And by cleaning the tear, you prevent more herniations from happening. She okay? You want me to wait? You want me to wait? All right. You're doing great. Just lay still. So I don't do percutaneous. We do true endoscopic with an incision. We don't do this through a needle. Now that said, some surgeons call their technique percutaneous when it really isn't. I don't know why they would do that, but they do, so it's misleading. You're doing great. Just lay still. All right, I'm going to wait a minute and give her a little more time. Where is your pain? In her nose. Why is she having so much pain in her nose? Is her nose pressing on anything? Bernadette? All right, so let's see if we can get her comfortable and tell me when you want me to proceed. Normally we don't lose any blood, but when people take antiplatelet therapy, where their platelets are not working properly, and there's lots and lots of drugs and medicines, whether they're herbal and natural or they're prescribed or they're over the counter, that affect platelet function. So we try to tell our patients to get off the antiplatelet therapy drugs and do their best to get off those things 10 days before surgery. But you know, when you've been on aspirin for years and years, it literally takes a month for the platelets to go back to being normal. And we're not going to wait a month to do surgery. So there's always going to be some antiplatelet effect. Are you ready? Proceed? Yes?
Yes.
Shot? All right, we're now at the back of that disc, right where the herniation is. And this is definitely a painful disc for her, as we can all tell. She had a 10 out of 10 pain here. You can see the dilator going in. Now somebody may say, hey, there's really no disc left, so what's going on? Why does she have so much pain from that disc? And the answer is, the reason she has pain from the disc is there's a tear in the back of the disc, in the annulus. That tear is the source of the back pain. That's what we're going to go fix. I'm just going to give her a little more time so we can get her a little deeper.
For them. Water trap.
Are you comfortable making her a little deeper?
No, because we're having some issues with the CO2 monitoring. So that's the issue. Do you have a water trap there, Kristen? Okay, all Sky is getting it. All Sky is getting it.
All right, so Henry, while we're waiting, we're getting our patient more comfortable. Let's run the video on why do herniated disc or degenerated disc actually cause so much back pain in people.
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com. Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. a Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
This is Dr. Aru Duke-Majan, CEO and founder of the Duke Spine Institute. I'm here with one of my patients, and you've traveled from where to the Duke Spine?
Idaho.
Idaho, with your lovely husband, and we've had a few conversations. She came here to have her back fixed. How long have you had back pain for?
For over 7 years.
Okay. And what kind of work did you do before you retired, if you don't mind me asking?
It was desk work.
All right. And so you had back pain for 7 years. Did you have an injury to your back, or did it just kind of gradually come on?
It just gradually came on. I actually noticed it first in 2015 when I was gardening and I couldn't be up there for 8 hours. I was into it for about 4 hours and I had to take a break. And as time progressed, my breaks got longer and longer, and the amount of work I did in the garden was less and less.
Understood. And you're retired now. So what's it like having back pain limit your ability to do stuff when you're retired?
For me, it's very frustrating. I can't do that what I want to do. So we kept seeking solutions and nothing was working. They did work for a short while, but that short while decreased over time. It was shorter and shorter. My husband does research very, very well. Through his research, he found you. We read that you can fix my back, and you did fix my back.
That's right.
And I thank you.
You're welcome. So when did you have the Duke laser disc repair done and the Duke plasma rhizotomy?
I had those.
We've got our patient under more sedation, so she's more comfortable, and we're inside that disc. This is the L2-L4 disc, and this right here, I want to show you what I'm using the laser on is where all of her back pain's coming from. It's called the annular tear in the back of the disc. And believe it or not, there's not much disc left. She doesn't have much disc, but this tiny little thing, this is the cause of all of her back pain. This one and the next disc. She's doing a lot better, huh? Yeah, we've given her the best anesthesia we can do, as well as we've given her more local anesthetic to make her more controlled. I will say this, I didn't mention it earlier, and I will tell you folks, normally when we're doing these surgeries, we use a little bit of fentanyl, which helps with the pain of placing the tube, but we couldn't do that because some people are actually allergic to fentanyl. And of course, we all hear about fentanyl in the news. It's a dangerous drug. But obviously an anesthesiologist is the most qualified person to be administering fentanyl in a patient, because fentanyl is I know we hear it as a street drug, but the reality is fentanyl was created synthetically. It's a synthetic form of morphine. It was created for basically medical purposes, right? What? Only for the operating room. But unfortunately, it's become a street drug, and people are dying left and right. Long story short, some people are actually allergic to fentanyl, and when they are, you can't use it to help them. You can't use it in surgery. So without fentanyl, we're kind of in a situation where we don't have a really good alternative pain medication, especially if people are allergic to these narcotics. So anyway, everything is going beautifully. I'm almost done with this disc. Another minute and I'll be done with the one disc, okay? This is that herniation. You see the laser is the glass tube, and I've taken away the herniation medially. It's looking good. It's a little bit of haziness. I don't think it's a focus issue. I think it's just a little bit of blood in the liquid that's making it harder to see. All right, any questions from our audience so far?
Yes, we do. We have a comment and a question. The
Yeah.
comment comes from Lubisa on Facebook once more. And they, coming back to the PLDD, they said, thank you for your reply. Many doctors in the EU perform PLDD unsuccessfully and just take the patient's money and the pain remains. I refused PLDD.
Yes, you did the right thing, and I'm so sorry. This whole situation of taking your money and not fixing you happens in the United States too. It's not just Europe. We have a lot of bad doctors here as well, and unfortunately, almost every single doctor that deals with spine pain takes your money and doesn't cure your problem. So that's why we at Duke Spine are very selective about which treatments we offer patients. We offer treatments that actually work, and they really do work. But the most important thing, number one, you have to make the right diagnosis. And if you're not treating the right source of pain, you're never going to fix the pain. And there's a proper treatment, okay? There's the best treatment, and then there's other treatments that don't work. All right, we're done here.
Okay.
So I'm going to do a little antibiotic irrigation. But I've gotten rid of the herniation. I've gotten rid of the annular tear where her pain was coming from. I think her back pain is going to be gone. That simple little procedure right there, folks. And you need the endoscope because you can't do it without the endoscope. You won't see the pain source. And you need the laser because you cannot do it without the laser. So it's very important. Our success rate here with this procedure, getting rid of back pain, is about 98% over the years. And if we talk to our patients that we did surgery more than 5 years ago, their average pain relief is 95%. 95% of their back pain, 95% of their leg symptoms are gone. Still, a minimum of 5 years later. We did a study, and we had, I think, almost 80 patients. We published this data. It's been peer-reviewed and published. And the average follow-up was 6 years. So the minimum was 5 years, but it ranged from 5 years to around 8 years, and the average was 6 years. Those patients that we checked, and it was all the patients, so we weren't selective about who we talked to, we just talked to them all. And 95% of the back pain was still gone, okay? That's really good. There's no other spine surgery in the world that does that. The key is we would treat the right discs the first time. And I'll tell you another secret. Most patients have more than one painful disc. Okay? I would say the average, and this was in one of our studies, one of our first studies on the Duke laser disc repair, the average number of painful discs, symptomatic discs, was 2.4. Okay? That should be good. Let's see. Shot? Let's see. It's hard to say, huh?
What do you think are the thinking?
Shot? No, I felt a little more. I think we're okay. So I'm going to start taking the needle out and keep the guide wire in. Shot? Yep, guide wire is good. You can see it at the front of the disc, all the way to the front. You guys want to see that? Show the audience the guide wire up to the front. Yeah, right there. So now we're going to slide the dilator down the guide wire. And remember, what? Yeah, sure. Got to keep my anesthesiologist happy. Put some Novocaine. So as we put the dilator in, it was designed with 2 channels. One of them is for injecting numbing medicine as we're going in. So it makes the patient more comfortable. Personally, Sean, I don't think it matters. But because it's not really the muscle that hurts, it's the disc. It's like once you get down here by the arthritis area where their pain is, that's when it starts to bother them. Shot? Okay, so you can see the dilator sliding along the guide wire. Show them the tip of the dilator and how it's sliding along the guide wire, kind of gobbling up the guide wire. Using the guide wire as, well, a guide. It's a wire that's guiding, a guide wire. All right, we're ready. You guys ready? Shot? Now I will tell you, I have to make some adjustments here. You may not see them, but I adjust the angle of the dilator. And I adjust it to where I think is most appropriate for that patient's anatomy. So it's not just a matter of following the guide wire every time. It's following the guide wire, but making small adjustments. Good, go. And she seems to be a lot more comfortable. This should be another quick level, guys. I would anticipate 10 minutes maximum for this surgery. Shot. Shot. I think that's good. Any other questions at this time?
Yes, we have a question from
Shot.
Kimba on YouTube,
Perfect. Yep.
and they asked,
Hi, Kimba.
I'm currently in extreme pain, and this is what my MRI report says. Large posterior disc extrusion, 14 millimeters in depth, 13 millimeters in height, and 14 millimeters in width. How bad is this?
Well, Kimba, the reality is you've answered already how bad it is. You said you're in excruciating pain. So I assume that your pain's coming from the herniation, but without seeing your MRI, I can't tell you. So that's why I recommend you do a consultation. We have available online virtual consultation where you don't even have to come to our office. We do it virtually. So go ahead and put the link. It's dukespine.com/VC. VC stands for virtual consultation. Use that link and schedule a consultation. I'll look at your MRI and I will be able to tell you why you're having pain once I examine you and I look at the MRI. But I need the images, not just the report. Great question though, but definitely we can get rid of your pain. We need to see your MRI, see you on a Zoom call. All right? Don't give up hope. That's exactly what we fix. We fix painful discs, and that's what you have. You probably have more than one. That's the only thing I would warn you. Just because you have a really big one doesn't mean that's the only one causing pain. Most people have small herniations causing their pain. The amount of symptoms has nothing to do with the size of the herniation, typically. In other words, the worst pain can come from the smallest herniations. So don't use size as a guide to how bad you are. Use your symptoms as a guide to how bad you are. If you're asking me, do you need surgery? I would say 100% yes, you need surgery. And that's without even looking at your MRI. That's because I'm seeing how debilitated you are from the pain. That's why you need the surgery. You don't need the surgery because you have a big herniation. You need the surgery because you're suffering from it. Okay? And most doctors don't understand that. So don't listen to what other doctors tell you. You have a problem, it's totally fixable, but you have to go to the right place to get it fixed. Duke Spine Institute can help you. And if you want to do a virtual consultation, you just use the link that Henry has typed up, which is dukespine.com/VC for virtual consultation. Five minutes. We will be done in 5 minutes. So this patient, once again, is 93 years old. She trusts us to fix her back at Duke Spine. We're here. We're going to send her home today. By the way, these surgeries are outpatient. In case you didn't know, all of our patients go home an hour after surgery. Oh, I didn't tell you guys, but for those of you that watched the first surgery today, that patient was in the recovery room crying. Remember we did a bilateral 2-3 and 4-5? He was crying, his wife was crying because he's out of pain. He said he started moving around, and he could immediately tell the pain he's had for many years. Remember, he had a prior fusion. I didn't do that fusion. Somebody else did. But he was literally in tears because the pain is now gone. That's what we do here. That's just a little epidural bleeding. This is the back of the disc right here. We're already at the back of the disc. You could see a lot of material there, herniation and scar tissue. Starting to remove it with the laser. You guys doing all right? I need about 3 minutes max. It's just unfortunately some epidural vein just obscuring my view. Grab her. I'm looking laterally right now, and you can see, want to make sure I don't leave any lateral herniation. If you're an endoscopic spine surgeon, you must look laterally as well as medially. You have to go both ways. All right, just about done. Another 1 minute and we'll be done. Any questions?
Yes, we have another question from Lubisa on Facebook once more. And they asked, can I send you an MR opinion by email? I think they meant MRI by email. I travel a lot during my treatment in Croatia.
Yeah, we only do our MRI reviews one way, okay? One way and only one way. You must fill out the form on our website. You must give us your MRI images. You must send us your report. 3 things. Fill out the questionnaire and send us your MRI images, all of them, and send us your report. If you don't do it that way, we can't do the MRI review. We don't use reports. I don't look at emails. I'm a very busy doctor. Believe it or not, a lot of people contact me and say, hey, can you look at this picture? And it's like, that's not how we do it. I'm sorry. I'm not going to look at your picture. I'm not going to look at your report and give you an opinion. If you want my opinion, we offer it to you. It's very easy to get, but we need all the information, which is your MRI images, your MRI report, and your history, historical questions. And all that's found on our website. Did you put the link up? dukespine.com/VC.
Of course, yep.
Yeah, just look at the link in the text, and that's how you do it. There's no other way to do it, okay? If we start doing other ways, we're going to spend hours and hours on each person just trying to get all the documents together. And we don't have hours and hours, okay? So we can do it this way very efficiently and very accurately and precisely, and that's how we do it. Until there's a better way, this is the way we do it. All right, we're done. She did fantastic. Both discs were severely painful for her. That pain is going to be gone now. All right, we've got 3 more to go. And you guys see the incision?
Yes, we do.
Beautiful, 1/4 inch incision. Nice job, everybody. Thank you. Go ahead and type your questions up for me, and I'll be in the recovery room. I'll be in the broadcast room in about 5 minutes. I'm going to answer your questions for you. Okay? And also check out the Duke Spine app. It's free. There's no charge to use it or buy it. And it has lots of good information. EBL, I'm going to say is 3 mil, 5 mil. All right, I'm here with one of my patients who traveled from Australia to Florida to the Duke Spine Institute for treatment. And you look happy today.
Yeah.
Yeah? Why are you so happy?
I'm happy because my back pain is gone.
Your back pain is
and
gone.
my leg pain is gone
Awesome.
from the disc. Yeah.
From the surgery yesterday.
Surgery yesterday. Yeah.
And you had the Duke laser disc repair.
I had the Duke laser disc repair. Yeah, that's right. Yeah.
So why did you come all the way to Florida from Australia for the Duke laser disc repair?
I've been suffering from back pain and leg pain for nearly a year after an accident. So I did a lot of conservative treatment like physiotherapy, exercise physiology, but it hasn't cured my pain. The pain was chronic, and I've been suffering from a lot of issues, emotional frustrations and things, and sleepless nights. But a couple of neurosurgeons back in Australia has offered me a surgery. They both offered me a fusion, which I don't want to go for. So then I have looked into Dr. Duke. I found Dr. Duke, and he's doing an amazing job doing a laser technology and also doing very minimally invasive procedure. So I thought this is what I wanted, and it's a faster recovery. I could go back and work back within a couple of weeks. So that's why I traveled all the way from Australia to US.
Yeah, and we did your surgery just yesterday evening.
Yeah.
So it's around 12 hours now from the surgery, and your pain is gone. And you can see in the video here where we did the laser surgery, we got into your disc endoscopically, and we used the laser to clean the tear in the back of the disc at L5-S1 where their pain was coming from all the inflammation. And now that back pain is gone. And you didn't have to have fusion. You didn't have to go to the hospital. You didn't have to deal with narcotics, right? You said you took a couple of anti-inflammatories and a muscle relaxer yesterday.
Yeah, but I didn't have much pain about with the surgery because it's laparoscopic and minimally invasive, I believe.
Yeah, that's correct. That's correct. So there's not a lot of trauma. There's no scar tissue. There's just a little incision. And of course, we don't remove any bone or ligaments from the spine. It's all done minimally invasive and naturally. So it's a natural healing of the disc. Now, you said just a minute ago you were suffering with a lot of pain and the effects of pain on your psychological well-being. And I know what you do. You're a nurse who helps patients that have behavioral issues, like anxiety, depression, and maybe other things. But you can appreciate how devastating chronic pain can be on people and their loved ones around them.
That's true. Yeah, I completely agree. It not only disturbs you, also your family. That's what I understood. So psychologically, after a few months, I should say, you will have that frustration of chronic pain, and then your behavior start changing towards others as well. And it's not only about you. It's also about your people living around you. That's very important. Yeah.
You came here for a purpose. You got your surgery that you had hoped to do. Now you're going to go back to Australia.
Yeah.
You got a long trip ahead of you coming up. And how do you feel about your experience here at Duke Spine overall?
Oh, it's really good. Staff is really welcoming, and it's spot on, and they receive you with a smile, and which is really great. And my father was telling, it's amazing how he never thought that in American health system, people like the clinicians are like this. So he was treated differently probably before while he lived in US, but it was really amazing, and your staff is really cool.
Thank you.
Yeah, they're welcoming. They're good.
Thank you very much.
And you are the best. I
appreciate it. It's an honor to take care of you, and it makes me feel so satisfied to see you happy and out of that pain. So congratulations.
Thank you, doctor.
You're welcome.
Yeah. If you're suffering from back pain, this is like a very good cutting edge technology and very advanced surgery, which Dr. Duke has developed his own, and without minimal, no damage to the bone, no damage to other things, and easily approaching to the disc and removing it. He is very skillful in reaching there without, manipulating any of your muscles or anything. And you can see from me that I have recovered within few hours after the surgery. So I would say if you don't want a long-term complications from the surgery, this is the best surgery you can get done by Dr. Duke here.
Congratulations once again.
Thank you, doctor.
grand. This is Dr. Duke Majan, and you know, we're just having fun here in the broadcast room. We have just completed surgery on this patient who, she is 93 years old, going on 94 in March. It just goes to show you folks, there's no age that's too old if you have minimally invasive, gentle, delicate spine surgery. Now, not only did she throw us with her age, but she threw a curveball. She's also allergic to one of the medicines we typically use during the surgery, so we couldn't use that medicine. It made it a little bit more challenging for us. Good news is surgery went perfect. It was quick and I think very decisive. So we know from the discograms that her back pain was definitely coming from that L2-3, L3-4 disc. I was able to get in there and clean the tear with the laser to eliminate her back pain. It went really well. Didn't have any problems. She's got about an hour to recover and then she will be on her way home. I believe she lives locally. She's one of our few patients that are local. But like I said, about 80% of the surgeries you watch are from patients from out of the state and out of the country. We have a lot of people from countries like North Carolina, California, just kidding, states like North Carolina and California, and countries like Canada, South America,
Croatia.
We even had somebody from Croatia watching, but we haven't done surgery on anybody from Croatia. Anyway, surgery went well for this lady, and I think she's going to be very happy with the results. Do we have any questions?
We have no current questions, but we do have a comment from Kimba on YouTube from answering of their disc extrusion. They said, "Thank you for answering my question. Unfortunately, I'm not in the USA and don't want to waste any more of your time."
Oh, Kimba, you're not wasting our time. Don't worry, it's not a waste of time. But Kimba, if you want answers, you need to use the virtual consultation. You can be anywhere in the world and I can meet with you. We have people that meet us from Africa, from India, from Asia, from China, Japan, everywhere in the South America, United States, obviously Europe. So we have people from Australia we do these virtual consultations with. Kimba, I'm going to tell you a piece of advice. Use the virtual consultation. Why? Because you need a diagnosis. Your large disc extrusion may not be your only problem. You may actually have other discs that need to be fixed. You're going to want to know that now before you start your treatment. All right, well, thanks for joining us. We have 3 more surgeries to go. Our next one is a patient who has traveled here from out of state. He has 3 herniated discs, L3-4, L4-5, L5-S1. He has back pain and left leg pain. So we'll be seeing him in about